But I like telling patients, and this is that patient, pretty much, I'd say 90% of your low back that come in and didn't have a major trauma and they have an acute low back episode, they have an ileocecal valve syndrome as a component. Why? Because just like your heart, if you have a heart attack and a heart problem, it says pain where? Here. Your guts says pain where? Here. And the neurology is on the same circuit. So their quadratus lumborum is going to tighten up, their QL is going to turn off. This postural muscle, if this iliacus is shut off, that means his opposite side is over tightened, which is why he has torque. He's tightened up this way. That's why the torque is there, right? It makes sense. So with that, we're going to continue this pain pattern, and this C5 is getting better. He's not grimacing at me anymore, right? I was looking for you earlier. It's getting better. It'll get better. And then the biceps tendon, it'll be really tender on the right, but it's nothing on the left. Like, you can rub it all you want. And then you get over here and you touch it, and they like want to punch you. I've only been hit twice in practice. So you're just rubbing it. And this is taking a long time with me explaining to you, but I'm telling you, it takes like an extra 45 seconds in practice, and you'll watch your lower back cases go, like, get way better, way faster. So here, getting better. And then we go to the ASIS here. A little tender. Right ASIS, right under the ASIS, kind of on the inguinal ligament, the superior part of the inguinal ligament. And then you go 4 fingers up from their medial malleolus. There's some acupuncture point that an acupuncturist can tell us what it is. But it's just a little pressure point. Doesn't feel good. The next one's the worst one. So. This one doesn't get better as you bang on it, so just do it like 10 times. And then this one, right here, is the worst. And it's in the medial calf. I think it's bladder 50. It's a point. And it, like, once you find it, like, it's not cool. I'm gonna do it to teenagers. You're a freak. Yeah. You like this one? He says, yeah, he agreed. Yeah, good pain. So you just rub it and then release it. And then you go back and then you can muscle test. So he's not gonna touch the ileocecal valve now because we just released that pattern. And then he's gonna push up with this iliacus. And you can stand on it, right? He's gonna come right back though, because you gotta take it back to the spine every time. Why? Because we're chiropractors, gosh darn it. And we adjust people. So we're gonna adjust C5 and L1. I'm gonna do L1 2 ways. It's probably cool, you might like this one. There's a long lever, anterior L1. If you need it, we'll do it. Where you can release that L1, and then your C5 is gonna, we'll see which way it needs to go. C5 right there. And I just, so in order to go through those facets, what's the angle here? 45. You can't do it right from the head of the table. Do I do it from the head of the table a lot? Yeah. Am I lazy? Sometimes. But to do it right, got to get over here and go that way. Try it. Try it with your fingertips. So like, I'm going to cup his ear. I'm going to go this way. Then this hand doesn't move. It's all here. It's not this. Okay?